Hello my dear future nursing officers, welcome back to my channel. How is your preparation for MHSRB? I hope you all are doing great. Without wasting your time, let's start first MCQ. How many milliliters of water sample is required for physical and chemical examination? Option A 4000 ml, option B 2000 ml, option C 1000 ml, option D 3000 ml. We will see correct answer. Option B 2000 ml of water is required for physical and chemical examination. Move to next MCQ. Passage of meconium stained amniotic fluid in first stage of labor indicates. Option A maternal distress, option 2 fetal distress, option 3 rupture of membranes, option 4 progress of labor. Answer is option 2 fetal distress. Now we will see about amniotic fluid abnormalities. Amniotic fluid is pea soup color or green color indicates fetal distress, and saffron or greenish yellow indicates post maturity, and hemolytic or golden color amniotic fluid indicates RH incompatibility, and dark brown indicates hemorrhage, and tobacco juice color indicates intrauterine death. And we will see amount of amniotic fluid during pregnancy. In 12th week 50 ml, 16th week 100 ml, 20 week 400 ml, and 36 to 38 week peak level. So, 800 to 1000 ml of amniotic fluid, and at a term week 40 week 600 to 800 ml, and 42 week amniotic fluid is decreased 200 ml. Let us move to MCQ. The type of isolation indicated when pathogens are transmitted through feces. Option A blood isolation, option 2 respiratory isolation, option 3 enteric isolation, option 4 skin isolation. Answer is option 3 enteric isolation is correct answer. Move to next MCQ. Perception in the absence of external stimulus is called. Option A paranoid delusion, option 2 illusion, option 3 delusion, option 4 hallucination. Answer is option 4 hallucination is a perception in the absence of external stimulus. And we will see illusion, false perception present with real external stimulus called illusion. Move to next MCQ. Surgical removal of an ovary is option 1 oophorectomy, option 2 tubectomy, option 3 laparotomy, option 4 colpotomy. Answer is option 1 oophorectomy we call surgical removal of an ovary. Move to next MCQ. Crime is the major social problem faced by option 1 tribal societies, option 2 agrarian societies, option 3 modern industrial societies, option 4 rural societies. Answer is option 3 modern industrial societies is correct. Next MCQ. The digestive enzyme present in gastric juice is option 1 ptyalin, option 2 renin, option 3 pepsin, option 4 trypsin. Answer is option 3 pepsin is present in a gastric juice. Next MCQ, valvulus is option 1 adhesion in the bowel, option 2 ulcer in the bowel, option 3 infection in the bowel, option 4 twisting of the bowel. Answer is option 4 twisting of the bowel we called valvulus. Next, the measurement of non-pregnant uterus is option 1 5 centimeters long, 2.5 centimeters width and 1.25 centimeters deep. Option 2 7.5 centimeters long, 5 centimeters wide and 2.5 centimeters deep. Option 3 3 centimeters long, 1.5 centimeters wide and 0.75 centimeters deep. And option 4 10 centimeters long, 7.5 centimeters wide and 5 centimeters deep. Answer option B 7.5 centimeters long, 5 centimeters wide and 2.5 centimeters deep is non-pregnant uterus measurement. Next MCQ, habits are learned through option 1 behavior, option 2 repetition, option 3 actions, option 4 knowledge. Answer is option 2 repetition is correct answer. Next MCQ, Janani Suraksha Yojana was launched on option 1 12th April 2005, option 2 28th Jan 2005, option 3 15th October 2006, option 4 10th February 2006. Answer is option 1 12th April 2005 is correct answer. Next, process recording is a option 1 written record of conversation between the nurse and patient, option 2 report written by nurse about total family of patient, option 3 set of instructions of doctor written by nurse, option 4 written doctor of conversation between patient and family. Answer is option 1 written record of conversation between the nurse and patient. Move to next MCQ. One of the following is a probable sign of pregnancy. Option 1 increased BMR, option 2 skin pigmentation, option 3 Hager's sign, option 4 palpation of fetal parts. Answer is option 3 Hager's sign is probable sign of pregnancy. We will see next MCQ. The depth of chest compressions in cardiopulmonary resuscitation should be option 1 2 to 3 centimeters, option 2 5 to 6 centimeters, option 3 7 to 8 centimeters, option 4 1 to 2 centimeters. Answer is option 2 5 to 6 centimeters depth of chest compressions in CPR. Next, smallpox in India is eradicated on option 1 March 3rd 1985, option 2 August 28th 1976, option 3 August 15th 1947, option 4 April 23rd 1977. Answer is option 4 April 23rd 1977 eradicated in India. Smallpox causative organism is variola virus and orthopox virus. Next MCQ. The factors that are not the part of research study but may affect the study variables are called. Option 1, independent variables. Option 2, research variables. Option 3, demographic variables. Option 4, extraneous variables. Answer is option 4, extraneous variables is correct answer. Move to next MCQ. Removal of fibroids leaving the uterus behind is a surgical procedure called. Option 1, hysteroplasty. Option 2, myomectomy. Option 3, hysterotomy. Option 4, hysterectomy. We will see correct answer. Option 2, myomectomy is a surgical procedure. Next MCQ. Which of the following is a priority nursing assessment for patient with depression? Option 1, nutritional status. Option 2, fluid and electrolyte balance. Option 3, sleep disturbance. Option 4, suicidal ideation. Answer is option 4, suicidal ideation. Now we will say about depression. Depression means sadness of mood. So in this depression, three types: mild, moderate and severe. In mild, we will see delusion of guilt and delusion of accusation, and we will see moderate. In this condition, patient have hopeless, helpless and worthless, and severe condition we will see. So present nail stick. Nail stick means patient thinks there is a no God, nothing. Move to next MCQ. Barlow's test for the newborn is used to detect. Option 1, humerus dislocation. Option 2, hip dislocation or dysplasia. Option 3, femur position. Option 4, eye coordination. Answer is option 2, hip dislocation or dysplasia. Next MCQ. Alzheimer's disease is characterized by option 1, speech problem. Option 2, vision problem. Option 3, hearing problem. Option 4, memory loss. Answer is option 4, memory loss we will see in Alzheimer's disease. In this condition, acetylcholine neuroenzyme decrease. Move to next MCQ. When the student learns first hand information in the natural setting, it is called. Option 1, symposium. Option 2, field trip. Option 3, laboratory method. Option 4, seminar. Answer is option 2, field trip is a correct answer. Move to next MCQ. Which one of the following is antipsychotic drug? Option 1, chlorpheniramine. Option 2, amlodipine. Option 3, guaifenesin. Option 4, haloperidol. Answer is option 4, haloperidol we will use in antipsychotic drug. So antipsychotic drugs having a extra pyramidal symptoms, that is akathisia, dystocia, pseudo-Parkinsonism and tardive dyskinesia will see antipsychotic drugs extra pyramidal symptoms. Move to next MCQ. An accurate and factual statement written, signed and dated by the person who has prepared the document is known as. Option 1, doctor's document. Option 2, legal document. Option 3, nurse's document. Option 4, patient document. We will see correct answer. Option 2, legal document is the correct answer. Move to next MCQ. The Food Alteration Act was initiated in the year. Option 1, 1964. Option 2, 1940. Option 3, 1954. Option 4, 1970. Answer is option 3, 1954. In the year Food Alteration Act was initiated. Next MCQ. Which of the following announcement in the hospital indicates medical emergency? Option 1, code blue. Option 2, code yellow. Option 3, code red. Option 4, code green. Correct answer. Option 1, code blue is the announcement in a hospital for medical emergency, and code red is any fire accidents happens in a hospital area, so we will announce in code red. Move to next MCQ. Fear of heights is termed as option 1, agoraphobia. Option 2, gamophobia. Option 3, algophobia. Option 4, acrophobia. Answer is option 4, acrophobia means fear of heights, and we will see agoraphobia. Agoraphobia means fear of places and situations in environment, and gamophobia means fear of marriage relationship, and algophobia means fear of physical pain. Next MCQ. Social phobia refers to an option 1, irrational fear of family. Option 2, irrational fear of teachers. Option 3, irrational fear of talking and doing activities in groups. Option 4, irrational fear of friends. Correct answer. Option 3, irrational fear of talking and doing activities in group is called social phobia. Move to next MCQ. Budget that is spent on purchase of supplies, minor equipment and repairs is considered as option 1, operating budget. Option 2, capital expenditure. Option 3, central expenditure. Option 4, manpower budget. Answer is option 1, operating budget is using in spent on purchase of supplies. Next MCQ. Total uterus seen outside the introitus is known as option 1, uterine descent. Option 2, enterocele. Option 3, procedentia. Option 4, rectocele. Answer is option 3, procedentia is correct answer, and rectocele means pelvic organ prolapse, the supportive wall of tissue between rectum and vaginal wall weakness, and enterocele means herniation of a perineum area. Move to next MCQ. Infection detected while doing diagnostic or therapeutic procedure is termed as option 1, iatrogenic infection. Option 2, subclinical infection. Option 3, nosocomial infection. Option 4, latent infection. Answer is option B, subclinical infection. An iatrogenic infection means while doing any procedures and surgeries to introduce infection through healthcare provider, we call iatrogenic infection. And nosocomial infections means, so after admission of the hospital within 48 hours patient get any infection, we call nosocomial infection. And latent infection. So, latent infection means, so organism is present in the patient's body, but not showing any sign and symptoms. So, we call latent infection. Move to next MCQ. BRAD's score is related to which of the following investigation? Option 1 mammogram, option 2 echocardiogram, option 3 hysterosalpingogram, option 4 ultrasonogram. Answer is option 1 mammogram is the correct answer. So, mammogram is used to X-ray of the breast for helps to know the breast cancer, and echocardiogram means it helps to know about cardiac activity. It is painless procedure. And hysterosalpingogram means use contract dye to helps diagnose uterus and fallopian tube. And ultrasonography means image test to make the pictures of organs and organ functionings to know in USG. Move to next MCQ. Filling of records and reports should be done according to option 1 patient, option 2 area, option 3 hospital, option 4 ward. Answer is option 1 patient. Move to next MCQ. The smallest bone in human body is option 1 tibia, option 2 fibula, option 3 scapula, and option 4 stapes. Answer is option 4 stapes is the smallest bone in human body, and smallest muscle in the human body is stapes muscle is smallest muscle. Move to next MCQ. Nalgonda technique is used for option 1 aluminum filtration, option 2 sulfur filtration, option 3 phosphorus filtration, option 4 water defluoridation. Correct answer option 4 water fluoridation is used in Nalgonda technique. Next MCQ. Temperature required to store majority of the vaccines. Option 1 plus 2 degrees Celsius to 8 degrees Celsius. Option 2 at room temperature. Option 3 below 0 degrees Celsius. Option 4 minus 200 degrees Celsius. Correct answer option 1 plus 2 degrees Celsius to 8 degrees Celsius is correct answer. Next MCQ. Health has been viewed as free from diseases. It is a option 1 holistic concept, option 2 biomedical concept, option 3 psychological concept, option 4 ecological concept. Answer is option 2 biomedical concept. Next MCQ. The restraint used for infants while collecting blood specimen is option 1 jacket restraint, option 2 crib net restraint, option 3 mummy restraint, option 4 elbow restraint. Answer is option 3 mummy restraint used while taking the blood sample in infants. Next MCQ. The information which is perceived only by the clients is option 1 verifying data, option 2 instruction data, option 3 objective data, option 4 subjective data. Answer is option 4 subjective data is correct answer. Next MCQ. Aspiration of pouch of Douglas is done to diagnose option 1 fundus disorder, option 2 ovarian disorder, option 3 pelvic abscess, option 4 fallopian tube disorder. Answer is option 3 pelvic abscess is correct answer. Move to next MCQ. Surgical intervention of tympanic membrane perforation is option 1 extraction of pus, option 2 removal of wax, option 3 stapedectomy, option 4 tympanoplasty. Correct answer option 4 tympanoplasty is a surgical intervention of tympanic membrane perforation. Next MCQ. Which of the following is not under UNICEF coverage? Option 1 family planning, option 2 immunization, option 3 child nutrition, option 4 protection child rights. Answer is option 1 family planning is not coverage under UNICEF. Next MCQ. Helicobacter pylori infection leads to option 1 peptic ulcer, option 2 hepatitis, option 3 nephritis, option 4 pancreatitis. Correct answer option 1 peptic ulcer is caused by Helicobacter pylori. Next MCQ. Penicillin was discovered by option 1 Jacob, option 2 Jenner, option 3 Alexander Fleming, option 4 Waxman. Answer is option 3 Alexander Fleming discovered penicillin. Next MCQ. Patient perceived rope as a snake. It is an example of option 1 delusion, option 2 sublimation, option 3 illusion, option 4 hallucination. Answer is option 3 illusion is correct answer. Move to next MCQ. The best method for birth spacing is option 1 intrauterine contraceptive device, option 2 oral contraceptive pills, option 3 female condom, option 4 Dutch cap. Answer is option 1 intrauterine contraceptive device is best method for birth spacing. Next MCQ. The type of isolation recommended for immunocompromised client is option 1 contact isolation, option 2 respiratory isolation, option 3 enteric isolation, option 4 reverse isolation. Answer is option 4 reverse isolation is correct answer. Next MCQ. As per Erikson, the psychosocial development of the toddler is option 1 intimacy versus confusion, option 2 autonomy versus shame and doubt, option 3 identity versus confusion, option 4 trust versus mistrust. Answer is option 2 autonomy versus shame and doubt. Next MCQ. cause of acidosis in diabetes mellitus is option 1 increased ketone bodies, option 2 decreased respiratory function, option 3 decreased renal function, option 4 increased protein metabolism. Answer is option 1 increased ketone bodies. Move to next MCQ. The most important function of neutrophils and monocytes are option 1 clotting, option 2 osmosis, option 3 phagocytosis, option 4 coagulation. Answer is option 3 phagocytosis is most important function of neutrophils. Next MCQ. Esprit de corps refers to option 1 sense of achievement, option 2 sense of loss, option 3 sense of gratitude, option 4 sense of cohesion and support. Correct answer option 4 sense of cohesion and support is correct answer. Move to next MCQ. Which of the following is given for preventing tuberculosis? Option 1 Salk vaccine, option B Sabin vaccine, option 3 BCG vaccine, option 4 MMR vaccine. Answer is option 3 BCG vaccine is to preventing tuberculosis. Next MCQ. Blepharitis means option 1 inflammation of cornea, option 2 inflammation of lens, option 3 inflammation of eyelids, option 4 inflammation of iris. Answer is option 3 inflammation of eyelids. Next MCQ. Example of vector-borne transmission is option 1 mumps, option 2 hepatitis, option 3 rubella, option 4 malaria. Answer option 4 malaria is vector-borne transmission. Now we will say vector-borne diseases. I will tell you easy trick for remembering KFC MD J. K means Kala Hazar, F means filaria, C means chikungunya, M means malaria, D means dengue and J means Japanese encephalitis. Move to next MCQ. Bleeding from the nose is called as option 1 laryngitis, option 2 mastoiditis, option 3 epistaxis, option 4 rhinitis. Answer is option 3 epistaxis is correct answer. Next MCQ. Professional ethics is based on option 1 number of certificates achieved, option 2 years of experience, option 3 knowledge, option 4 understanding and loyalty. Answer is option 4 understanding and loyalty is correct answer. Next MCQ. Mass approach of health education during epidemics is through option 1 television, option 2 home visit, option 3 personal contact, option 4 demonstration. Answer option 1 television is correct. Next, what was the biggest challenge after completion of your studies? This statement is an example of option 1 open-ended question. Option 2, closed-ended question. Option 3, fixed alternative question. Option 4, interview. Answer is option 1, open-ended question. Move to next MCQ. Non-directive counseling is also called. Option 1, counselor-centered counseling. Option 2, prescriptive counseling. Option 3, direct counseling. Option 4, client-centered counseling. Answer is option 4, client-centered counseling. Next MCQ. The most effective method of rodent control measure is option 1, fumigation. Option 2, trapping. Option 3, environmental sanitation. Option 4, rodenticides. Answer is option 3, environmental sanitation is correct answer. Move to next MCQ. Deficiency of nicotinic acid leads to option 1, pernicious anemia. Option 2, pellagra. Option 3, beriberi. Option 4, night blindness. Answer is option 2, pellagra is deficiency of the nicotinic acid leads, and pernicious anemia is deficiency of the vitamin B12, and beriberi will occur due to deficiency of the thiamine vitamin. So, in this thiamine will occur beriberi, two types, dry beriberi and wet beriberi. Dry beriberi involves in nervous system and wet beriberi involves in cardiac conditions. Now we will see night blindness. Night blindness is occur due to deficiency of the vitamin A. So we will call retinal also. Move to next MCQ. Infection acquired during hospitalization is called as option 1, healthcare associated infection, we will call nosocomial infection also. Option 2, subclinical infection. Option 3, latent infection. Option 4, idiopathic infection. Answer is option 1, healthcare associated infection or nosocomial infection. So, nosocomial infection is after admission of the 48 hours, patient having any infection we call nosocomial infection. Move to next MCQ. Written law which is formally passed by the government is known as option 1, bill. Option 2, act. Option 3, amendment. Option 4, legal document. Answer is option 1, bill is a written law formula passed by the government. Move to next MCQ. Followed by cleft palate repair, child should be placed on option A, upside down. Option B, back. Option 3, abdomen. Option 4, laterally. Answer is option 3, abdomen position. We call prone position also. So, we will keep after cleft palate repair in prone position, and cleft lip repair we will keep in lateral position. Move to next MCQ. Large and deep seated abscess of the skin and subcutaneous tissue is called option 1, furuncle. Option 2, carbuncle. Option 3, pseudofolliculitis. Option 4, folliculitis. Answer is Option 2 carbuncle is correct answer. Move to next MCQ. Dramatization based on a particular theme is called. Option 1 mimicry. Option 2 mono action. Option 3 role play. Option 4 group play. Answer is option 3 role play is dramatization based particular theme. Move to next MCQ. Which of the following is an example for non-absorbable suture material? Option 1 plain catgut. Option 2 vicryl. Option 4 chromic catgut. Option 4 proline. Answer is option 4 proline is non-absorbable suture materials. Sutures are two types, absorbable and non-absorbable. In absorbable is broken down by body internal organs and non-absorbable suture is not broken down by body, external only. Plain catgut is a natural suture. So, in absorbable suture again divided two types, natural suture and synthetic suture. So, plain catgut is comes under natural suture. So, it is yellow color. So, 5 to 10 days it is observed. Vicryl is comes under synthetic natural suture. It is violet color. So, it will absorb within 2 weeks. And chromic catgut is comes under natural absorbable suture. It is a brown color and absorb within 90 days. Move to next MCQ. Bell's palsy is a disorder of option 1 facial nerve, option 2 hypoglossal nerve, option 3 accessory nerve, option 4 optic nerve. Answer is option 1 facial nerve is correct answer. Move to next MCQ. The normal renal blood flow is option 1 1200 ml per minute, option 2 650 ml per minute, option 3 700 ml per minute, option 4 125 ml per minute. Answer is option 1 1200 ml per minute is a normal renal blood flow. Move to next MCQ. The hormone that inhibits ovulation is option 1 prolactin, option 2 progesterone, option 3 serotonin, option 4 estrogen. Answer is option 2 progesterone is correct answer. Next MCQ. Who is the chairman of Health Survey and Development Committee? Option 1 Kartar Singh, option 2 Srivastav Committee, option 3 Mudaliar Committee, option 4 Bohr Committee. Answer is option 4 Bohr Committee is a chairman of Health Survey and Development. Next MCQ. An example of primary group is option 1 workers, option 2 employees, option 3 family, option 4 students. Answer is option 3 family is a primary group. Next MCQ. Infants intramuscular injection is given to option 1 rectus femoris muscle, option 2 ventrogluteal muscle, option 3 vastus lateralis muscle, option 4 deltoid muscle. Answer is option 4 vastus lateralis muscle for intramuscular injection in infants. Next, Indian Nursing Council was established in the year. Option 1 1936, option 2 1954, option 3 1947, option 4 1945. Answer is option 3 1947 is Indian Nursing Council was established. Next MCQ. The delicate innermost membrane of the brain is option 1 pia mater, option 2 dura mater, option 3 flora, option 4 arachnoid matter. Answer is option 1 pia mater. So, brain is having 3 layers: dura mater, pia mater and arachnoid matter. So, outer layer is dura mater, inner layer is pia mater and arachnoid matter is middle layer of the brain. Next MCQ. A failure in professional duty and practice that leads to an injury to the patient is option 1 benevolence, option 2 crime, option 3 malpractice, option 4 defiance. Answer is option 3 malpractice is correct answer. Move to next MCQ. Fever in which there is an interval where temperature is elevated for several hours followed by an interval when temperature drops back to normal is called. Option 1 inverse fever, option 2 remittent fever, option 3 constant fever, option 4 intermittent fever. Answer is option 4 intermittent fever. We will see. Inverse fever means morning temperature is higher than in the evening temperature. Remittent fever means same like intermittent fever. This fever fluctuates throughout the body but never falls all the way back to the baseline normal temperature. Next, constant fever. So, it means temperature does not comes to the baseline temperature. Move to next MCQ. Which of the following drugs are used to expel the gas from intestinal tract? Option 1 carminatives, option 2 diuretics, option 3 emetics, option 4 antidotes. Answer is option 1 carminatives is a expel the gases from the intestinal tract. Next MCQ. The suture between two parietal bones of the fetal skull is called option 1 sagittal suture, option 2 frontal suture, option 3 coronal suture, option 4 lambdoidal suture. Answer is option 1 sagittal suture is between the two parietal bones and coronal suture is between the frontal and parietal sutures and lambdoidal suture is between the occipital and the parietal suture. Move to next MCQ. In India, the first school of nursing was started at option 1 Government General Hospital Madras, option 2 Government General Hospital Calcutta, option 3 Government General Hospital Hyderabad, option 4 Government General Hospital Gujarat. Answer is option 1 Government General Hospital in Madras. Move to next MCQ. Concroid is a option 1 genital ulcer. Option 2, skin ulcer. Option 3, breast infection. Option 4, vaginal infection. Answer is option 1, genital ulcer is the meaning of cancroid. Okay, my dear future nursing officers, today's session is completed. If you have any doubts about this session, please let me know in comment box. I will clarify your doubts. So, please watch full video without skipping. I have given some tricks about questions for remembering. Please watch it. If you like it, please do subscribe, like, share and comment. And don't forget to click the bell icon. Thank you. We will meet you in tomorrow with a new session.